What's up, everybody? I'm Dr. Josh Jagoda, and today we're going to discuss inversion tables because I get this question all the time. Should I use an inversion table for my low back? And we have to talk about a few things because this is really popular and a lot of people get good results with this. So should you use this? First things first, there are a few medical conditions in which you should be wary, or maybe you should avoid it, or maybe you should get some doctor clearance from your medical provider. Things like glaucoma, detached retinas, elevated heart rate, blood pressure instability, stuff like that. If you have, maybe even if you just came off of a broken or surgical foot or ankle, this is probably not going to be good for you because your feet are going to be strapped in too. So keep that in mind. There are a few other conditions, but also one of the things I'm going to mention right away is I would highly recommend that you have somebody in the house just in case you get stuck upside down. I know a lot of people think that's pretty funny, but it's happened before. Don't let that happen to you. Aside from that, this is a pretty big contraption. It's larger. A lot of people see those ones on the infomercials. They've stuck them behind the door. This can fit behind the door, but this one's a little bit larger. It's a little bit more sturdy. It's a little bit wider, and in all honesty, it's better to have the wider, sturdier ones because that means you're going to have more support, less risk of injury if it's a sturdy piece of equipment, right? The wider the base, the better off. The heavier the base, the better off. And that's just a safety concern. So now that that's out of the way, I'm going to talk about another safety concern with regard to the low back. If you are on this for low back pain, I really recommend that you guys don't go upside down entirely. And if you do decide to do it, you do it for only 15 to 20 seconds maximum, and then you come back up. But this one particularly has a lock around 70 to 80 degrees, and it goes all the way down to there, just about that. So this is what it's going to look like. I'm going to get on here, you're going to go all the way down, and you're not going to go all the way up. Or pardon me, all the way up, upside down, that is. The reason is that you're going to have a lot more pooling, a lot more blood flow going down to the head. Yeah, you'll get more traction into the spine, and that's the whole goal of these inversion tables, is to decompress the spine. It's really to take the two blocks or the vertebra and pull them apart just like this. The problem is if you're completely upside down, you have to worry about, is this going to stay up? Are you going to get stuck upside down? Is it going to have any adverse side effects? And any adverse side effects can happen at any angle here, right? So if you're having a low back pain that's acute, meaning it's really serious, you just sprained your back, this is probably not going to work for you. If you're having something that's severely painful right now in the low back, it's probably not going to work as well, because what you're doing is you're decompressing so much. Well, after you decompress, what do you have to do? You have to recompress through gravity. You have to stand back up. And sometimes, and I've seen this in the DRX 9000 traction tables, I've seen these on the manual traction tables, I've seen these on inversions. When you get off of these decompression tables or types of machines, you're going to notice some recompression. So in the days that you are not doing this, it is always good to rehabilitate your spine. You should never rely on one single contraption or device to fix your low back pain, because that is not how it works. This should be used in conjunction with rehab. This should be in use with conjunction with stretching, chiropractic, physical therapy, other manual methods. So don't rely on this. This may really help you and decompress, but it's not going to solve, okay? You're the one that has to go out and do it. So make sure that that is a thought process on your mind right now, because also, the more you decompress, meaning go completely inverted, that is where you can run into that trouble. So you got to really figure that out. For that reason being, I really recommend that you out there, if you're going to try this, you go at the lesser angle and you do it systematically, I should say. You really want to be smart. You want to start with 15 seconds and then come back up for about 30 seconds. Go back down for 15 seconds, go back up, and then maybe you're done for the day. You have to be progressive. You can't just go upside down for 2 minutes, expect the low back pain to go away like that. You can't. You shouldn't, and you'll end up hurting yourself. So then you'll start blaming the machine or the inversion table because you hurt your back. And you're gonna say, I hurt my low back on this inversion tables. Inversion tables don't work, things don't work. Well, is it the inversion table that didn't work, or did you not use the inversion table properly and now you're blaming this? And it's probably that one, all right, guys? I know that sounds really weird and funny to say, but you have to be progressive. Just like an exercise routine, if you are going to lift 200 pounds and you've never lifted before and you're gonna lift it as heavy, as hard as you want, you're gonna be in pain the next day. And you're gonna say, what, the gym didn't work, I didn't get stronger? So think about that. You really want to be progressive. My high recommendation is to do about 3 to 4 sets of 15 to 30 seconds, maybe 20 seconds. It's just like a stretch, right? You're going to stretch your arms for about 15 to 30 seconds. You're going to repeat them over and over. You're going to do the same thing with your back, where you're going to give some downtime in between. So what I'm going to do is, I already have this locked in. You want to make sure your sides are locked in. These ones do not lock, but there are clips to keep it from folding in. So this is the back side of it, and I'm going to show you what it looks like when I'm in here. This is also, I highly recommend using the strap that's under here. It's locked in place there. So you can see this is as far as it goes. My feet will go down in here, and it's already set up for my height. So what I'm going to do is I'm going to show you how to use it. Alright, so my butt goes up against here. I'm going to hold on to the side so that if I accidentally go backwards, which you shouldn't, but I'm going forward, I'm going to adjust the foot, ankle and foot. Again, if you have ankle foot problems, think about this again too. So now my feet are going to lock in. And I'm gonna just push down and lock them in tight. So I like to test my ankle and feet to make sure I can't slip out, because that's the last thing you need to do, is slip out and hurt yourself. And then what I'll do, again, I really recommend you guys have somebody at home. I'll hold on to the arms here, and I'll go upside down. You can feel slowly. So right here I'm balancing. This is how I would recommend. Is start in this position, and then as I let go, this is almost takes no weight to do this, just to hold it here. Look at my fingers, you can use my pinky, like as long as my hands are here, you'll be fine. So I'm staying here, and I'm slowly going backwards. Slowly going backwards. And at this point in time, believe it or not, guys, I can already feel the decompression happening in my lower back. And so I'm just gonna stay here. Even though I'm slightly vertical, and the more vertical I get, meaning head to the ground, the more decompression I'll get. And then that's what I'll be like, upside down. So here, we'll hang out here. I can put my arms up. I recommend, just staying here and being comfortable at first, and then you can put your arms up later. And you can stay here for 15 to 30 seconds. After those 15 to 30 seconds, you can take my arms and I'm going to pull up. I can really start to feel my back decompress, and I can really feel the blood flow coming to my spine. I'm going to stay here. If you need to come up a little bit more, you should not be getting dizzy. Again, I've done this before, guys, but if you've never done this before, you want to probably take about a minute and get out of this thing and just see how you felt. Because if it ends up hurting you, this is probably not going to be good for you right away. This is a great tool to use for prevention. And this is it right here. I'm putting my arms down to the side, and this is fully locked out at about 70 to 80 degrees. Maybe it's 60. I don't have a goniometer or something to measure it, but I'm locked into place. And this is one of the better ones I've seen. So one of the more important things that you do here is relax your spine, relax your breath, really focus on the intention. If you want, you put your hands here, put your hands here, which is, if you're new, I'd recommend your hands here, especially on these, if it has these cross grips like this blue grip does. It's really easy to like almost pull yourself up right here, and then come back down, guys. Just like that. So this is how to use an inversion table, guys. Hope you liked it. Hope this episode was valuable for you. And I'll see you guys for the next episode. Don't forget to subscribe to our channel. Happy decompressing, guys. See you next time.